Welcome to this informational video about comprehensive prevention planning in California, creating a plan of child and family well-being. This presentation is brought to you by Strategies Technical Assistance. Strategies Technical Assistance, or Strategies TA, supports county prevention planning teams in the development and implementation of comprehensive, evidence-based child abuse prevention plans. Our work is centered on strengthening families through a lens of equity and inclusion. Strategies TA is a program funded by the California Office of Child Abuse Prevention, also known as OCAP. Both the Child Abuse Prevention Center and the Children's Bureau of Southern California co-lead the Strategies TA effort. What is child and family well-being? Research shows that when families are healthy, safe, and economically stable, their children's health and well-being can thrive. Well-being can include our physical, economic, social, emotional, and psychological states, as well as our satisfaction with life and engagement in activities and work. What is child abuse prevention? Prevention in the context of child abuse and neglect means reducing the risk factors that lead to child maltreatment. Prevention services and supports help protect children and produce thriving families. Currently in California, counties are working on comprehensive prevention plans to prevent child maltreatment and strengthen overall family and community well-being. When it comes to child abuse prevention, there are three levels: primary, secondary, and tertiary. Primary prevention strategies are universal activities and programs directed at the general population to strengthen communities and improve child well-being. Secondary prevention strategies are used to support children and families when a need arises. Tertiary prevention strategies are interventions and services when child maltreatment has occurred that aim to reduce the negative consequences of maltreatment and to prevent its reoccurrence. Why are we focusing on child abuse prevention? Research shows that the health, well-being, and quality of life of children, families, and communities are impacted by their environments. Because of this, it is important that the prevention efforts aim to improve social determinants of health. Social determinants of health are the conditions in which we live, work, and play. This includes education access and quality, healthcare access and quality, economic stability, the neighborhood and the built environment, and social and community context. Here are a few, but not limited to, examples of primary prevention strategies when reflecting on the social determinants of health framework. In the area of education access, tutoring supports, Head Start, and parenting classes are primary prevention strategies. In the area of social and community context, neighborhood councils, leadership development, and family resource centers, or FRCs, are primary prevention strategies. Please take a moment to review some of these additional strategies listed. Another framework that guides this prevention effort is protective factors, which are conditions in individuals, families, and communities that promote the health and well-being of children and families. These include concrete supports, economic development, social connections, social and emotional competence of children, parent resilience, knowledge of child development, and social and emotional competence of adults. When protective factors such as these are present, the chances of child maltreatment decrease and the likelihood of developing a healthy and supportive environment for optimal child development emerges. What is comprehensive prevention planning? The comprehensive prevention planning process provides a comprehensive plan that would design a system of child abuse prevention and overall community well-being. The plan will help design a system where families can get the help they need wherever they go. It will also create a system where agencies are closely collaborated to align their efforts. Comprehensive prevention planning is a complex process. Some components include community engagement, which means involving community members in the process, asset mapping, which means reviewing what is already available and what is still needed in a community, cross-sector collaboration, which means working across various organizations and systems towards a common goal, and equity, which means creating systems that all children and families can access and use without barriers. So what's next? We want to thank you for joining the statewide effort to eliminate child abuse and neglect. Moving forward, here are some questions to consider. 1. What is my purpose, goal, and role in joining this effort? 2. What experience and knowledge do I bring to the table? 3. What do I need more information about? 4. Who else should be involved in this effort? To learn more about comprehensive prevention planning and statewide prevention efforts, here are a few resources to explore. First is the California Department of Social Services, or CDSS, website on Families First Prevention Services Act, or FFPSA. If you have specific questions, you can contact them through the listed email. The next resource is the California Training Institute, or also known as Caltrin. They offer several webinars and trainings on prevention, comprehensive prevention planning, protective factors, and several other topics. Lastly, we at Strategies TA also offer additional resources on our website relating to the comprehensive prevention planning process, prevention planning strategies, and our work with counties throughout the state. Thank you for viewing this video.